Hello, I'm Dr. A.A Kujur, currently working as a Deputy Medical Superintendent in Central Coalfields Limited Hospital. So about me, I passed my MBBS in 2016, then did my internship in 2017, then joined a house surgeonship from 18 to 19. Then in 2020, I joined Central Coalfields Limited as a senior medical officer. So I have gained around 4 years of experience in medical consultancy. So for today's topic, we are here to discuss about the acid reflux during pregnancy and some ways to manage it. So we'll be talking about something about heartburn, acidity, and their causative agents, and some ways you can manage it in home. And of course, lastly, there are some medicines also available. So acidity or heartburn. First of all, what is it? It's excess buildup of acid in the stomach, which sometimes regurgitates into the food pipe, esophagus, which causes a burning sensation in stomach, or most commonly referred by patients as just burning sensation. So due to lack of awareness in patients, they refer to it sometimes. So it's very common in pregnant ladies, mostly during the first and the second trimester in around 30 to 50% of patients, and even some around 80% of female patients, they report acidity and heartburn around third trimester. So now coming to the causes, basically there are two factors which cause acid reflux in the stomach. First of all, the most obvious one is the physical changes in the body. As during the pregnancy, a female goes through many physiological changes. As the baby is growing, the size of uterus is growing, baby inside is growing. So naturally, it exerts some physical pressure on the stomach. So naturally, the capacity of the stomach is reduced. So overfilling it, most often the most common cause is overeating, which causes the acid reflux. Secondly, there are some hormonal changes like increased level of prostaglandins, which causes the relaxation of smooth muscles, even the lower esophageal sphincter. It is the opening of the stomach, the esophagus opening. So these are the few causes. The progesterone one is really okay. So now additionally, the pregnancy can displace the lower esophageal sphincter to the thoracic cavity. It is a physical cause, like the stomach is growing, the uterus is growing, so it pushes the stomach back, which is an area of negative pressure. So naturally, it causes regurgitation of the acid content back to the esophagus, which causes the heartburn. So in our daily practice, encountered this problem many times. First of all, the scenario here is rural. Many women here are uneducated. They don't know proper ways, food to maintain a healthy diet, so they face these problems. There are some ways in which we can manage the acid reflux. So first of all, the most obvious one, which I've talked earlier, is overeating. So you should try to eat less food. You can divide your meals, like the 3 meals, you can divide it up to 4 to 5 meals. Taking small quantity of food more frequently will reduce the risk and cause of acidity. So this one. Now, the secondly, maintaining an erect posture or even walking is very beneficial. We have seen it in many cases. So walking after taking food is also good, which contains the acid in the stomach. So avoid lying down right after taking the meal. You should at least have a 2 to 3 hours minimum duration before you go to bed after having your food. So furthermore, by maintaining the position of your head while lying down, you can say you can increase the height of your bed, the head side one, by up to 3 to 4 inches or even more, the, as per your comfort. So it will prevent the backflow of acid in the esophagus. Furthermore, we should avoid some foods which naturally cause the acid buildup, like the spicy foods, most obvious, excess chili, excess spices, they cause harm. Oily foods, some citrus fruits you can say, like lemons, tomatoes, and anything containing acids, they cause acid reflux. Even caffeine, chocolates, and carbonated drinks, you should avoid that during pregnancy. And even you should try to opt for healthy diets like whole grains, so yeah, fruits, vegetables, etc. Most important thing is to stay hydrated during. the pregnancy. So drink plenty of fluids, drink plenty of water. Of course, you should avoid taking plenty of water during your meals. Should dilate the stomach and furthermore cause you problem. Furthermore, clothing is also important. You should always wear loose and comfortable clothes. Tight clothing will exert pressure from outside and again will cause the acid reflux. Now, you should also watch your weight. It's very important to watch your weight during pregnancy. Do regular exercise, do frequent walking. No one is asking you to do heavy exercises. Just frequent walking will help you control your weight. Excess weight will again in turn put pressure on your abdomen and cause acidity. Awareness is very important during this population. So now, of course, there are some medicines which are available which you can take. Like, for example, there are natural antacids over the counter. They are easily available. Antacid preparations, most commonly the sodium bicarbonate on the parietal cell of stomach.
Sir, last line repeat please sir.
Okay.
Mute हो गया था. Yeah.
Okay. So we were talking about the management of acidity and heartburn. There are some medicines which are available, which are easily available over the counter. So the most common preparation is the antacid preparation containing sodium bicarbonate, which is considered really safe during the pregnancy. Next is the class of medication is the S2 receptor blocker, which act on the histamine receptor on the parietal cells of the stomach and which blocks the step in acid production. For example, we have ranitidine, which is considered the safest in pregnancy. Famotidine. The other class of drug is known as the proton pump inhibitor. It acts on the last step of acid production. More specifically, it acts on the hydrogen potassium ATPase pump. So indirectly, it reduces the acid production. The safest one is the omeprazole. Next, maybe pantoprazole or lansoprazole. So now, concluding this, acid reflux during the pregnancy is not a very big problem until it's manageable. You can seek medical attention if the symptoms are very severe, persistent, associated with pain abdomen, difficulty in swallowing the food, or even in most cases, loss of weight is also seen. So maintaining a healthy diet with regular exercise prevent the acid reflux during your pregnancy. So lastly, to conclude, again, we'll be taking up some of the cases which I've been managing in my hospital. So currently, right now, we have 9 months, about 42 weeks around. Patient admitted in our ward. She came with the complaints of pain abdomen, nauseated, and of course, heartburn also. Obviously, this is the last stage of pregnancy. The size of the uterus is really big. So we are managing it, our ward, by giving the same medications, oral antacids, proton pump inhibitor, and also we in our daily practice we take up many camps in our rural areas where we go and try to educate people about this pregnancy, some ways to avoid heartburn, how to manage. And obviously, we also distribute some medicines. Now, another case right now also admitted in a hospital, 3 month pregnant lady, also having the complaints of nausea and heartburn, acidity, and okay. Another case which I was discussing is female patients, 3 months pregnant, admitted in our wards with complaints of nausea, heartburn, and even vomiting, pain around abdomen, and mostly followed by indigestion. So it is some enzymes are also there which are really good, containing the acid and digesting the food quickly. So taking enzymes also help during pregnancy. So we are managing the patients by giving some antiemetics, antacids, and some injectable proton pump inhibitors.